Thank you, Dr. DeJesus, and thank you to the NYOH Foundation for hosting this event and allowing me to tell my story. Everyone said radiation was so much easier to tolerate than chemo, and I held that close in the days after my mastectomy in December 2023 as my start date for radiation neared. I was about 16 rounds into my 25 rounds when I started to fall apart. Up until that point, I had been a champ. The NYOH radiation technicians were all lovely and helped me get used to the routine. I held my breath when I was told to. The music was distracting, some days rock or reggae, country or jazz. It depended on which tech was in charge. And although I didn't enjoy radiation, I did enjoy meeting and chatting with other patients in the waiting room beforehand, while I knit a blue silk shawl with a simple, repetitive pattern to pass the time. I only had 2 weeks left. I was past the halfway mark. On this day, I buzzed myself into the radiation center, changed into my gown, and waited. But as I entered the dimly lit radiation room, removed the hat covering my bald head, took off my glasses, took my left hanging earring out, I felt so vulnerable and exposed. 2 more weeks of having to lay perfectly still, slightly on one side, with a tissue expander, so aptly described as looking like a sad sandwich bag by my breast surgeon, where my breast used to be, arms overhead, holding on to the handle, day after day, felt intolerable. I began to feel like I was running a race, but the trail was icy, and I was unable to make it to the finish line. Physically, radiation was so much easier than the 6 rounds of chemo I had completed in November 2023. But mentally and emotionally, I began to find it so much more challenging. I felt like I couldn't lay still or hold my breath when I was supposed to. My tightly closed eyes kept filling with tears. The reggae didn't distract me anymore. I was embarrassed with how I felt because outwardly, I appeared to be having an easy time. My skin was holding up remarkably well, with only a small area of irritation under my arm and on my collarbone. I wasn't nauseous. My taste buds were intact. But the dread I felt every morning going to that appointment was intense. I began repeating to myself, I am strong. I've got this, over and over while I was on the table as the radiation machines rumbled over and around me. It was a mantra that came out of my desperation. In those moments, I felt anything but strong. People often say you're strong when you're going through cancer treatment, but you have no choice except to be strong. The alternative was not an option for me. It's not always helpful coming from other people, but once I embraced it myself, it was empowering. Every day, I got to treatment first thing in the morning and rewarded myself afterwards with a simple cup of coffee and the time to enjoy it before heading to work. At the end of each week, I got myself a bigger gift, like a sweatshirt or a plant. To celebrate the end of radiation, I reclaimed a piece of pre-diagnosis me and, with the blessing of Dr. Oles, my radiation oncologist, ran the Snow Moon 5K with my husband on February 24th, 2024. The day after my last treatment. The wind bit at my face as I ran, and tears of relief streamed from behind my sunglasses. It was so cold and so hard, and I was so slow, but I did it. Those 25 rounds of radiation took a good chunk of my sanity and changed the skin under my left arm and across the left side of my chest. It left the muscles in those places tighter as well. After all this, I still had to do 12 rounds of targeted treatment, a shot in my thigh every 3 weeks, and a daily aromatase inhibitor for roughly 5 to 10 years, but both thankfully with minimal side effects. I had blood tests that resulted in scans that resulted in more scans, and some that resulted in biopsies, all showing that I thankfully remain NED, no evidence of disease. I heard over and over that I looked so good, and I must be so happy to be done with cancer. But I learned you're never actually done with cancer. Every time I reached to put my seatbelt on and the tissue expander limited my range of motion, I was reminded. As I dressed for my daughter's wedding, with hair just long enough to be a serviceable crew cut, with deep furrows of a receding hairline on each side, I was reminded again. In late February 2025, I began taking a medication that reduces my risk of recurrence, specifically brain metastasis. It comes with an assortment of anti-diarrhea medications and warnings about food triggers that should be avoided for the year I'll be on it. Being limited to just 1 cup of decaf per day, that's the one that's hardest for me. 6 pills, taken once a day, and the worry of and planning for their potential side effects that remind me daily of my cancer diagnosis. I went with some trepidation to my first Survivor event in May 2024, held at a park in Kingston along the Hudson. It was hosted by the Health Alliance Hospital Oncology Support Program that I regularly attended. We were given name tags and told to write how long we had been a survivor on them. I had to ask, how do I know how long I'm a survivor? Am I a survivor this early in the game? I was told I became a survivor the day I was diagnosed. By that metric, I was a 10-month survivor. We were given candles and called up to light them based on our time as a survivor. When all the candles were lit, the line of survivors spanned both sides and the back of the large outdoor pavilion. As we moved to make space for each person, my eyes filled with tears. This was nothing new. I'd been crying pretty much daily since being diagnosed in July 2023. But this felt different. These tears felt hopeful. 2 weeks later, I attended my first NYOH Survivor Brunch and knew I belonged. I really was a survivor. In late November 2024, I celebrated completing my targeted treatment injection regime and my reconstruction surgery with a tattoo on the inside of my wrist that says, "I am strong." It's my ongoing mantra. It's on the inside of my wrist so I can see it when I knit, because sometimes I just need to be reminded. I've moved into 2025 with strength on my mind and in my heart, not just on my wrist. As I work towards rebuilding my physical strength, it's helping me recapture my emotional strength and allowing me to do everything in my power to thrive along the way, even when it's hard. Not long after getting my tattoo, I decided to go through my unfinished knitting projects and pulled out that shawl I had begun in the radiation waiting room. The repetitive stitch pattern, which had been so rhythmic and soothing to knit during treatment, and the beautiful silky blue yarn was lovely, but the shape of the shawl was a disaster. The long rectangular wrap I envisioned looked more like a small lacy afghan or a giant bandana that would suit a giraffe. I ripped it out, restarted it, and once again, it has become my waiting room knitting because I love to make things for myself and for friends, because it's a great distraction, and because I have accepted there will always be another appointment as my team at NYOH and I navigate survivorship. I never expected cancer to be part of my story, but I am so grateful to Dr. Theodulu and the rest of the NYOH community that, like that yarn in that disastrous shawl, I too get a second chance. Thank you.